What's up, you guys? It's Kai here, and I'm going to take you guys with me on my second week of my critical care rotation. So let's get into it. My first week was kind of a mess. I actually just came back from California. I spent the holiday over with my family, so we had Christmas and New Year's. Now it is the start of 2021, thank goodness, and we're starting good. So the first week coming back into my critical care rotation, kind of a mess. So I fly back from California, hop straight into it, have 3 interviews last week. And as you can see, my interview setup is still back there. I got my softbox, my desk, my Rolleiflex LED light. So, we're doing it big. Might have gone a little bit overboard, but, virtual interviews, we got to do what we got to do, right? So I'm now taking you guys on my second week of my critical care rotation. We are actually in the cardiac ICU at the VA hospital. But first, I'm going to take you guys through my morning routine. So my morning routine is as follows. I have a journal activity as soon as I wake up at 4:50 in the morning. When I'm done with that, I put on my clothes, I head off to the gym, do whatever workout for about 45 minutes to an hour, and then I come back, I meditate for at least 10 minutes, take a shower, eat breakfast, and then I'm on my way to the hospital. So I just finished my journal activity. Now I'm going to take you guys with me to the gym, and then we'll come back, we'll hop in the car, head to the VA. So we'll see you. So just a quick little workout this morning. I got the deadlift behind me. Only a little bit of weight this morning just because I'm going to come back to the gym with my friend Connor to hit legs. So I'll probably only be here for another 15-20 minutes, finish off the rest of the morning routine. So let's get into it. This is a meal prep I did earlier this week. I love to meal prep. It's just super convenient, super efficient with the time, so definitely recommend meal prepping. So this should be enough food for the day. Let's hope so. We'll keep our fingers crossed. Fun fact, actually, I've had this lunchbox since I was in the 3rd grade. So Mom, if you're watching, hope you're proud of me. But now we're making our way to the VA hospital for the critical care rotation. So I'm actually on the cardiac ICU. I've got my laptop. Of course, I've got my stethoscope just because this is cardiology and we might need to listen to some hearts. So typical issues we might encounter on this rotation include myocardial infarction. So people who have a heart attack, that's probably the majority of it. Any acute coronary syndrome or just general coronary artery disease. So we'll be doing a lot of stenting and medication management. So a patient who gets a stent will have to put them on aspirin and Plavix for about a year. And just managing blood pressure and other cardiac related issues. So let's do it.
that you, Piccolo?
Hey guys, so right now I'm on my way to my School of Medicine campus. As part of our critical care rotation, we have to do a standardized patient, and a standardized patient is just a person who is essentially a paid actor to act like a patient who has a certain medical condition. And as a medical student, we're responsible for asking them questions, doing the relevant workup to try to see what the problem is, make a diagnosis, and make a treatment plan. So that's what I'm about to go do now. It's about 7 o'clock, 7:30 right now, and I have an interview at noon. So about to head over to campus right now, do this standardized patient, get back, get ready for this interview, and we're gonna keep it moving. So I'll see you guys. So I just now got to campus. I'm about 30 minutes early for my standardized patient appointment. I still have a whole bunch of thank you letters, thank you emails to send to the programs that I've been interviewing at over the past week, so that's what I'm going to be doing now. I'm in a study room that's on campus, and admittedly, I have not been here in like almost a year. As a fourth year medical student, I really don't spend that much time on the academic portion of the campus. I spend most of my time in the hospital. Considering that I'm on my critical care rotation as well, I've been mostly at the VA hospital, and when I have interviews, I've been at home doing my virtual interviews. So I've just been kind of running back and forth. And I'll admit it's like a little bit nostalgic. I'll see some of the lower year medical students, the first and second year medical students in the study rooms, books, papers strewn all over the table as they're studying for their upcoming board exams. And it's kind of cool. I'm definitely glad I'm not in their position. I remember that time, and it was really stressful trying to jam all this information in as there's new information coming. So definitely don't envy them, but glad to be here. So they really deck out these study rooms with a bunch of resources for us. They got this flat screen TV with whatever attachments. They got some wipes for the table because obviously we're in a pandemic and we need to stay as sanitized as possible. A bunch of chairs for group studying in non-pandemic situations. I have my favorite breakfast snack with me, my peanut butter and banana sandwich, and I got my giant water bottle because, I get thirsty. So I'll see you guys after.
Any allergies?
No allergies to anything. Actually just had an interview today.
Yeah?
Yes.
For...
So I'm interviewing
like-
for otolaryngology, head and neck surgery.
Yeah.
And oh my gosh, this week has just been such a barrage. I had 6 interviews in 7 days.
Oh my gosh.
So.
I mean, I bet you're really good at interviewing now.
Oh yeah, yeah. Like I have some skills.
That's the upside, right? Okay. Do you want me to count down or just do it?
Oh
or
yeah,
what do
just
you
go
think?
for it.
Just go for it. Okay.
Mhm.
People surprisingly really care.
Mhm.
So I've guessed a couple times and gotten wrong. So I'm just asking. You're vaccinated. Woo! No bleeding or anything. Okay. Hard part is over.
Awesome.
You did great.
I feel like $1 million.
really cute. Like,
Like a song of love that clings to me.
So today was definitely busier than most days. I first had my standardized patient for my critical care rotation. Then I had an interview for residency. And right after the interview for residency, I went and got my COVID vaccine, baby. Check it out. Boom. You see that? Yeah, there we go. Boom. So yeah, definitely kind of a whirlwind day. It's funny because my original COVID vaccine was scheduled 2 days from now. But during my interview, I had like a 30-minute break. So I checked my email, and sure enough, I saw that I was taken off the wait list and I could schedule my appointment earlier. So I just went ahead and called the appointment hotline, scheduled it for after my interview. So as soon as we wrapped up, got up, threw on my scrubs, and went back down to campus. Got my vaccine. So finally certified, taking steps to end this pandemic one vaccine at a time. And so we're in the game. Now that I think of it, I don't think I scheduled my follow-up. I'm going to have to do that now that I think about it. But, here we are. So if you couldn't tell already by the sheer formality of the setup, this is actually my interview background. And there was a lot of thought put into this. I actually reached out to my mom, who has this great eye for design, to help me set up this background. Let me see if I can point to it. Right here we got the books angled appropriately. We got the plant, we got the desk lamp. And the desk lamp is on, by the way, so it can light up that book just a little bit. So my mom helped me with the design component. I was the expert behind the lighting. And this isn't the actual lighting of my interview setup. I got this lighting changed and tweaked just a little bit for me to talk to you guys right now. That's probably the number one compliment I've gotten so far on the interview trail. It's mentioned at least like 3 or 4 times, And this is not something I anticipated. I was just doing this because, I like having that aesthetic look. That's just my personality. I was not even doing it to, get any likes or anything like that. But, man, people have just been eating it up, and they've been complimenting me on it, asking me about the books, asking me about the setup. It's been great conversation fodder for, like, small talk. I get to tell them about how I'm into photography and videography and all that. I was thinking that since I was getting so many questions and comments about my background, maybe I could do a tutorial or something. So if you guys are interested in that, let me know down in the comments. I can throw that together. That'd be awesome. Anyway, I am back home for the evening. I don't have any interviews for the next several days. So looking ahead toward tomorrow, I'll be back to the VA, back in the cardiac ICU, taking care of patients.